are continuing our weekly series with Rochester Regional Health for Heart Month. It is the month of Valentine's after all. We're focusing today, though, on heart failure, the signs to look out for, how you can prevent it, and the care available here in our area. So we are joined now by cardiologist Elizabeth Lee. Dr. Lee, thank you so much for joining us this morning.
Absolutely. Pleasure to be here. Thank you.
So, of course, we think of, Heart Month with, like I was joking, Valentine's and whatnot. But it's so important, I think, too, to focus on heart health. We know Go Red for Women was last week, and that every 80 seconds a woman dies from heart disease. So it's especially important for women, too, who may be watching us this morning.
Absolutely. The incidence of heart failure in people over 40 is the same for men and women, about 1 in 5. But actually that increases as we age, and it becomes more prevalent in women as they age. So definitely important for women to pay attention to that, especially after menopause and in the later years.
Are there any conditions that maybe a woman might have as far as weight, health, any of that that could affect it as well?
Well, we definitely know that the hormonal changes as women age play a big role. It increases their risk of heart attacks. So women who have hypertension, obesity, and high cholesterol as they age become at higher risk for heart disease in general, and that includes heart attacks. And heart attacks are one of the risk factors for heart failure, along with all those other risk factors. So it's definitely important.
Women we have it the hardest, Dr. Lee. Am I right? I mean, not only that, but I'm sure stress has to play a little bit of part of it. And I can't help but think of all of the moms right now who are working from home, trying to educate their kids from home, dads too. But I just feel like as moms, sometimes you just take on more of that stress.
Absolutely. A lot of times women in my practice, I'll find that they are caregivers for many other members of their family, and then they tend to put themselves last. So they may come to care later than their male counterparts because of that, because they're dragging their male loved ones to the doctor but not going themselves. So definitely important to remember that you can't care for others until you care for yourself. And if you're having any concerns about your own health, that you need to prioritize that.
Yeah, and we know from talking about the Go Red for Women last Friday that some of the symptoms don't even seem like they would be associated with your heart. So you may not even put the 2 and 2 together and think, oh, I'll just deal with that later. I've got to deal with the kids and your husband or whatever else you're doing. So what are some of the signs, Dr. Lee, of heart disease in women?
So women definitely do get the same classic heart attack and heart disease symptoms that men do. Anytime that a man or a woman is experiencing chest pain or pressure, we want them to come in right away. But women may have some more subtle signs more commonly than their male counterparts may, and that would include things like feeling very fatigued, feeling just kind of nauseous, sick to your stomach. Those could be warning signs that there's something going on with your heart as well.
Yeah, and Dr. Lee, as far as care goes, if something does happen here in the Rochester area, what would you suggest?
Well, definitely if you're worried that there's an emergency, then certainly always calling 911 is important, and getting emergency care to yourself quickly. For more routine care, of course, I hope that everyone out there has a primary care doctor that they feel comfortable reaching out to. And then certainly the cardiologists here are always available for consultations if you would request a specialist.
Yeah, maybe you don't have to wait until you experience symptoms. If you want to get proactive about your health, getting a checkup can't hurt anybody, right?
Absolutely. The keys to helping yourself moving forward and living a long and healthy life are taking care of things before they become a problem. So making sure that you're getting annual physical exams and getting your blood pressure checked so that if you have high blood pressure, we're treating that. Making sure that you're getting your cholesterol checked as well so that we can manage that if that's an issue. Certainly exercise is really important. We recommend 30 minutes of exercise about 5 days a week, and that can even be gentle walking.
Yeah, I like it. We'll be walking inside though right now because it's a little cold outside.
Right. That's
Dr.
right.
Lee, thank you so much for joining us. It's great tips and we appreciate it.
Absolutely. Thank you so much.